Good afternoon, dear patients. Today we are going to talk about a case of hypertrophy of the sebaceous glands on the foreskin. A 25-year-old patient came to us with eruptions in the area of the foreskin. The eruptions were relatively firm and interfered with him during sexual intercourse. They rubbed against the glans penis and the foreskin, causing a number of inconveniences, which is why he sought help. During the examination, there were visible small vesicles, I would say, that somewhat resembled eruptions, including those seen with herpes. There was a slight coating, so tests were taken for herpes, human papillomavirus, candida, Gardnerella, and some other sexually transmitted infections to start with. These tests were taken from the surface of the foreskin, the surface of the glands, as well as from the urethra. A comprehensive smear was taken, and as a result, all sexually transmitted infections came back negative. The patient was diagnosed with hypertrophy of the sebaceous glands, specifically of the foreskin. If similar glands suddenly appear, for example, on the glands or on the lips, they are called Fordyce granules. But this phenomenon, generally speaking, distinguishes between where they are supposed to be and where they cannot be. So, if sebaceous glands appear in places where they shouldn't be, on the lips or accordingly on the glans penis itself, then they are indeed called Fordyce granules. But if they are located where they are perfectly allowed to be, for example, on the foreskin, then this is not considered a Fordyce granule in the classical sense. These are simply hypertrophied sebaceous glands. Indeed, due to the influx of hormones at a young age, they can increase in size, become larger and relatively denser. As a result of which, even in the absence of inflammation, they can cause mechanical pain, especially during sexual intercourse. Accordingly, the patient was offered, first of all, the option of circumcision, which he declined. And secondly, we carefully, after testing on a few spots, cauterized these sebaceous glands using a laser and radio wave method. They were almost completely removed since sebaceous glands are located superficially, so there were no scars left after this procedure. As a result, in the second stage, we removed almost all the sebaceous glands that were bothering the patient, and basically his complaints disappeared. Therefore, in such cases, if the patient is not ready for such a radical procedure as circumcision, which, for many men, is a significant operation at an older age, then, accordingly, one can try to resolve the issue with these kinds of cosmetic procedures, which is exactly what we managed to do in this case. So it's not always necessary to resort to such radical methods. If you need diagnosis and treatment of various pathologies in the genital area, you can consult the dermatovenerologists and urologists at our medical center, paid KVD, in Moscow. We have qualified specialists who diagnose both infectious diseases transmitted sexually and non-infectious diseases in the genital area. We look forward to seeing you at our clinic. Subscribe to our YouTube channel and our Instagram channel. Thank you for your attention.